Sometimes, small things create big problems, and a small change in your hip bone may be causing you pain and limiting your range of motion. Doctors don't know how many people actually have this condition. Studies show it could be up to 70% of Americans, and most of them are under 40. Hips come in all shapes and sizes, but the shape is directly related to your chances of developing hip problems such as osteoarthritis and even needing hip replacements. This silent condition is so often overlooked that it didn't even have a name until 2003. It's called Femoroacetabular Impingement Syndrome, or FAIS. The problem is many people who have it don't have early symptoms. That's why we want to identify the Chicagoans with FAIS, especially in lower-income neighborhoods, where access to specialists or surgery may be hard.
It actually goes misdiagnosed often. The education and the skill set for the providers who actually treat the condition is pretty slim.
That's why we need to get the word out about this condition to doctors and the public. Using MRIs, we'll look at the hips of 50 Chicagoans. If any of them have FAIS, we'll connect them with the specialists who can treat it. Then, we'll work with doctors and public health experts to make sure this condition is getting diagnosed early enough, so that patients aren't getting hip replacements at age 40 or living their lives with hip pain.
If you can diagnose and treat FAI earlier on, you're potentially preventing the risk of developing arthritis. Research is important, obviously, for not only making people aware in the community about the issue, but also trying to figure out which patient populations are responsive to treatment for that condition, and if early intervention can be helpful in their entire lifetime.